Good morning, I'm Dr. Deuk and I'm here with one of my lovely patients who had the courage to undergo a 3-level Deuk laser disc repair for 3 herniated discs in his thoracic spine, T10, 11, 11, 12, and T12L1. And how long have you known about these herniated discs in your thoracic spine?
Since right after my accident, which is March 3rd, 2019. It's about a year and a half, a little less than a year and a half.
Mm-hmm. How are they diagnosed?
With MRIs,
Yeah.
as herniated discs, and treated with shots, cortisone epidurals,
Yeah.
and recommended fusion surgery.
Well, and you tried also, didn't you try stem cells or PRP at some
I
point?
tried stem cells
That
as well.
didn't work?
No, sir.
And we tried your facet joints first because we thought, well, maybe it's the facet joints that are causing
right.
the pain. And that helped a little bit, but didn't really fix the problem.
I'm not even sure that it helped. The only thing that really helped was the surgery.
All right, what surgery did you have?
If we're talking about in all my surgeries, I had 2 neck surgeries with 4 herniations, laser surgery.
Deuk laser disc
Yes,
repair?
and lumbar 3 herniated discs, same laser surgery.
And did those work for you?
Yes,
All right. But you hadn't had the thoracic disc treated until yesterday.
until less than 24 hours ago, yes.
And why did we finally decide to do the Deuk laser disc repair, endoscopic repair of those 3 herniated discs in your thoracic spine? Why did we decide to do that yesterday?
It was my only hope. Otherwise, I think I was looking at fusion. And you were willing to take a chance on me.
Yeah.
And it worked. And I noticed as soon as I woke up the difference.
Okay, so what kind of difference did you notice after your Deuk laser disc repair in your thoracic?
The deep pain that was inside my middle back, that was about that much, 6 inches worth of pain, nonstop for a year and a half, like somebody had a knife in my back, was gone.
Amazing. And you have some soreness from the surgery, but it's different now.
Yes.
So would you say your pain in your thoracic is cured?
Well on its way, yes. I would say yes.
Good. And are you taking any painkillers for the surgery, or
Yes.
what are you taking?
I'm taking Oxycontin and oxycodone.
But you were taking those before your surgery?
Yes.
Yeah. So, but you're not taking anything new because of the surgery I did, right?
No.
Power. So basically it's done, it's a small incision, 4 millimeters, we did 3 of them. And we're gonna get you off your painkillers. That's one thing I'm looking forward to,
looking
now
for
that we
that.
fixed the thoracic pain.
I'm looking forward to that too, as well.
And you're walking in here today, one day after surgery.
Yes.
You didn't go to the hospital, you
No.
had it outpatient. Anything you want to say to the rest of the world about your thoracic disc surgery?
Just thank you very much. You saved my life.
Oh, you're welcome. My pleasure. That's why we're here.
Thank you.
You're welcome. All right. Let's get you out of here.
Okay.